Welcome, Representative, and Mary and Alex and Sam. So glad to see you all here today.
Thank you, Chair Cohen and Lamar and Ranking Member Kennedy. I just want to thank you for raising, it was Senate Bill 279. I want to thank Senator Cohen for working on this issue. And I'm just going to, you have my written testimony, so I'm just going to turn it over to Mary, Sam, and Alex for their testimony.
Good morning. Thank you so much for hearing our opinion of this bill, and thank you for considering it. I sit before you a very proud mom. It's one of my biggest assets are my 2 adult kids who have lived most of their lives with a progressive genetic disability and decided that access has become so difficult for them to be part of the community that they wanted to start doing something about it. So I, being an able-bodied person, gets an opportunity to see what it's like to be granted access like everyone, and I also spend a lot of time with them and see the struggles that they have. So we have my son, Sam Bodie.
Hello, my name is Sam Bodie, and hello, Commissioner Cohen, Representative Candelora, and Representative Lopez, and Representative Kelly. Did I miss anybody else?
No, I think you're good, Sam.
So my name is Sam Bodie. And I've been working since fall of 2014 at my local high school. It's North River High School. And I'm a paraprofessional at North River High School, so I work with the seniors and the juniors at Capstone. And yeah. And I'm also in support of this bill because I think we need to stop the rule doctors from randomly just giving out these accessible placards. Okay.
Al?
Thank you very much. I'm Alex Boy, and I've really born in a brother, but
So Alex runs a profit called Peace, Love, Accessibility, advocating especially for accessible parking access.
I definitely you guys do for this bill. Thank you.
So as you can see, as a family, we're asking you to support SB 279.
And just to summarize briefly what the bill does is, you know, right now the handicap placards are issued through your doctor's office. Physicians will issue them to patients. The bill doesn't specify, or the law currently does not specify that it needs to be your treating physician. And with the world of the new technology, there are online platforms that can allow for people to actually register online, pay $150 or some other fee, and get access to a handicap placard without even going into a doctor's office and filming your disability and sending it into the doctor. I don't know if you want to just summarize
Sure.
the experience that they had.
we had a friend approach us who said, I'd like to try to get a placard. He's an able-bodied graduate student. So we said, that's great, take on the challenge. And he was able to, there's two, in our research with Peace, Love, Accessibility, we found 2 programs where you could pay to get your placard in Connecticut. He applied for both. One never responded to him but kept his money. The second one guaranteed a telemedicine visit. He was assigned a physician in Hawaii, never spoke to the person. It was via text message. They finally got back to him and asked him to videotape his gait. He videotaped a very obvious fake limp, and he was informed on Friday that he qualified for the placard and he'd be getting a Connecticut handicap placard.
Well, I just want to first and foremost thank you all for being here. For those of you that don't know, the Bodies and Mary Caruso are also a shared constituent with Representative Candelora. So I've witnessed firsthand the advocacy for the disability community on the whole. And I just want to thank you for that, for helping so many people across the state of Connecticut. And some of you may recall that this committee passed a accessibility placard council. We've been a little bit frustrated that it hasn't quite gotten off the ground yet, because I think it will be enlightening for that council to meet and to really dig into some of the issues around the disability community, challenges to parking and accessibility to our venues throughout the state of Connecticut. So I'm eager for the work of that council to begin. But in the meantime, I think hearing about some of these egregious circumstances where folks are being disingenuous about a disability to get themselves a placard and be able to park in handicap spots throughout the state of Connecticut is really concerning. And I know that there's some other issues that we need to address in terms of lifetime placards. Again, I hope that, together with DMV and together with my co-chair, we've really been urging DMV to convene these meetings, and I'm hopeful that will happen very, very soon now. I know a number of the appointments have already been made, but I think in the meantime, this bill really highlights some important, I don't want to say low-lying fruit, but it really is, and to some extent. We know that there's an issue here. We're seeing it proven. I know Representative Candelora and I were in a meeting the other night, and he showed me, about this particular physician that you mentioned. So I don't have any questions. I just really want to highlight your good work and advocacy. I appreciate you all so very much for doing it. It's because of you that we have this council. It's because of you that there's more awareness around this issue. So in gratitude, thank you all for being here and for testifying today. Representative Kennedy, followed by, did you have any questions? I'm sorry, Mr. Co-Chair. Do you have it? Yeah, my co-chair, Representative Wong.
Very quickly, thank you again for your years of steadfastness and work on this, both Sam, Alexandra, Mary Caruso. I really appreciate you coming up here today. And I recognize, and I think committee members recognize, that this has been years of work to even get to this point. We're still recognizing there are a number of unscrupulous people who will take advantage of the system, who will exploit any loophole that we have. So hopefully we can get this working group together so we can more quickly identify these problems as they arise and not force you guys to come all the way up here and testify and then spend 3 months arguing. Ideally, the working group would be able to recognize that there are unscrupulous actors in this space who are taking advantage of the laws that we have in place, taking advantage of the fact that things move slowly in government, and trying to either enrich themselves by going through this process, this patently illegal and immoral practice of like treating people via video that clearly are not handicapped as if they were, and taking up valuable real estate of being able to park in front of stores and visit doctor's offices and just go through your daily lives and have people with unwarranted handicap parking placards it infuriates all of us. Like I've heard from people on this committee, it infuriates us on a daily basis. We hear from constituents about what they encounter when they try to park in front of a local establishment that they need access to and they don't have it. So you've taken this on in a way that I know has taken up a lot of time and effort and energy in your life. I know you've dedicated a lot of your personal time to this. It is having a profound positive impact for people across Connecticut, and I thank you for that. I think sometimes when you're just fighting the next battle, it's hard to recognize sometimes that you've already had a tremendous positive impact for people, but you have. So we got more work to do, no doubt about it. We got to get this better. But you've already improved the lives of so many people, and I just want to say thank you. Thank you for your family commitment to this.
Thank you, Madam Chair, and thank you, Sam and Alexandria, for coming up today to testify. Thank you both for also submitting written testimony. Sam, SB, I really enjoyed reading your testimony, so I do thank you for that. And it's true, it's unfortunate that so many people would abuse a system that is meant to help those who really are in need. So just a quick question for you, Mary. With the amount of people that it seems that are abusing the system and have not, really don't have the need, can you tell me how many times that's impacted you as far as trying to find a handicapped space? Have you had to wait for a space? Have you had to try park further away? I mean,
So a multitude of things have happened to us, and I want to say we don't focus on, it's not our decision as to whether or not someone needs a placard. That's between a physician and their patient. But one of the things that happens very often, we have a ramp van because Sam and Al both use power wheelchairs. Many times they will go somewhere, they're able to get a spot because 1 out of every 4 spots is ramp accessible. So they can't park in just any spot. But we'll go somewhere, we'll finally find a spot, we'll open the ramp, we'll get out, we'll go to where we have to go, a doctor's appointment or work or site visits because I'm helping Al with her nonprofit. We'll come back to our van and there'll be a car parked in the access aisle, which is only next to a ramp spot so that we can get in and out. There's confusion among law enforcement. We've called law enforcement. They just don't know if they can give a ticket because the person may or may not have a placard. So we feel education is a huge piece. Public awareness can be a huge piece. We're working on a PSA right now with Quinnipiac University. We're hoping to bring more awareness. We have a very active Facebook page where we're trying to educate people. We're getting a tremendous response, positive, from the general public saying, I had no idea. Like, nobody told me. So we're working on the different reasons that people have problems with access. You know, we're also hearing from a lot of the disability community who say, we don't even go to the grocery store anymore because it's so frustrating to try to find that spot. So there are a lot of ways that we can all work as a community and a state just to improve access by learning about it and being more mindful and understanding the importance. It isn't just to run in somewhere. The other thing I'd like to point out about the online mechanism, I worry about the senior citizens that don't know how to get a placard. They Google it, they find this program to get a placard online. They have no idea that you can get a placard and there isn't a cost. So they're paying an online mechanism in meeting, not even meeting, getting connected with a doctor from somewhere else. They don't have to pay a fee to get that placard. So that's another important issue, is taking advantage of a population, whether senior citizens or the disabled community, that don't always have that kind of money. They don't have to pay that money.
thank you so much, Mary. Those are really very valid and important issues that you brought up, and I hope that we will get this council finally together. We certainly do need more public awareness. We need more education. And not only is it certainly probably frustrating, it's also probably dangerous, I would imagine, very dangerous. And I know there's so many people that don't understand that just because that the ramp next to it, you have to be able to get your ramp to come down so that the person can then exit the vehicle. And so, hopefully the council can also address the law enforcement portion of it. So,
We've been visiting police departments, and it's been very well received.
Well-
And we have surveys out also. So, we're gathering a lot of data to try to find out really where, the overriding sentiment is there needs to be public awareness and education from all our surveys and our visits with police departments.
well, thank you so much for that. And again,
Thank you.
thank you, Sam and Alexandria. And we look forward to getting the work done. Thank you, Madam Chair.
Thank you, Representative Kennedy. Representative Turco, followed by Representative Branco.
Thank you, Madam Chair, and thank you all very much for bringing this issue to the attention of the committee. Now, I know that in general there are not enough handicap spots available at almost any location that you go to, and then I've personally witnessed individuals without any placard parking there, whether they think it's temporary, that it's okay to be able to run in or something like that to the bank or use an ATM, which is not appropriate, or I've seen people park and then just disappear, illegally. So we already have that problem, and what you're explaining is people getting these placards that don't have a need for them, but in a legal way, really shows that we have to close that loophole and fix that. The one question I just had, though, is just to make sure there's no unintended consequences here. I could foresee a reason why somebody legitimately needs to use telehealth to get approved for the placard rather than having to go physically somewhere. So would this proposed legislation, the way it's written, prohibit anyone from doing that as long as they're going to their attending physician?
No, I mean, an attending physician could do a telehealth visit, and they would have the history of their patient. A lot can also be done online, so the DMV makes the prescription, the application available online, and then if a person had it, like Sam or Al could have a telehealth visit with their own physician to discuss, so at least the physician knows the patient.
Do a video telehealth.
Right. So I don't think it would prohibit someone from having a telehealth visit with their own physician.
Great,
But
thank
you
you.
could speak to that better than me.
That's correct. The bill would just specify it has to be your treating physician or practice. So you can't just get a stranger off the internet, like in this situation where they're in Hawaii, have no patient-doctor relationship, and they're issuing placards.
Thank you very much for that clarification, and thanks so much, everyone, for coming here today, your advocacy on this important legislation.
Thank you.
Thank you,
Madam
Representative Turco. And I do think it's important to speak to intent because we are in an age where there's more and more telehealth visits, and particularly in the disability community. Certainly, telehealth has become more normal when you have difficulty getting to and from appointments. So we really want to be clear on intent here, and we'll be working with our LCO to make sure that we have the language in a good place so as to not prevent folks having telehealth visits with their physicians here, particularly in Connecticut, but perhaps they see a physician in a specialty outside of the state as well. So we really want to be clear on that. Representative Branco.
Thank you, Madam Chair, and thank you, Representative Candelora and the Bodie clan for coming to testify today. Now, this seems like a no-brainer, and it's sad that we even have to address this with legislation, that there'd be people taking advantage online. But unfortunately, that is the day and age we live in. And I'm interested in this because I've run into a similar issue with service animals and support animals with tenants. And you can go online, buy a certificate from anybody who is licensed and registered, and pass that off to a landlord and say, I need a service animal. And that law was written, and it already does say, and so the onus is on the landlord, basically. It says it has to come from a local provider. So, a landlord can stop it if it's from someone, if you're in Connecticut and this comes from a provider in California, So I guess my question is here, maybe you can fill me in because I'm not really sure how these are issued, but I'm wondering how this is enforced. Because we can say it has to come from a physician within your practice, obviously. That's great. But I don't think, if this doesn't eliminate bad actors, how do we enforce this?
Yeah, under the statute, the current law has a criminal provision. So if a doctor is signing under penalty of perjury, they can be charged with a misdemeanor. So I would think if there's an out-of-state doctor that's doing this illegally, the enforcement is criminal right now. But certainly I think we could look at if that practice continues going through DCP or the Attorney General. But I'll say when we dealt with the telehealth, the optometrist issue with issuing prescriptions online, it was before public health a number of years ago, there was sort of a similar setup requiring the in-office visits, so we didn't replace it with online. We didn't need to do enforcement provisions because the market just listened to the law and corrected itself. But I would think that we might have to look at a different provision other than criminal if these online platforms continue to market itself in Connecticut, if this law were to pass.
Thank you, and I agree, and we can kind of correlate this with service and support animals because it is a problem. But I guess the person who's using an out-of-state platform, they're not going to tell on themselves. So I guess who would be responsible for reporting the online platform, and how do we stop that, if that makes sense?
Yeah, I think we'd have to look at that. I think probably, DMV would have some level of enforcement, but I would think the Attorney General's office would probably have a flexibility in going after these out-of-state companies to prevent them from having these platforms in Connecticut. So I think it would sort of be a civil action.
Yeah, thank you for that, and I agree. I think it's a good cause, and I'm sorry that this is even something that you have to deal with. So I hope we do take a look at this and make it happen. Thank you.
Thank you, Representative. And seeing no other questions, Representative O'Day.
Thank you very much, Madam Chair, and thank you, Leader, for your testimony here today. I will say I'm going back and forth between judiciary, but it is so frustrating for me to see people getting out and parking in handicapped spots and clearly not needing the handicapped spots. And I've seen it multiple times at the mobile station in the Merritt going back and forth where, there's people taking up the handicapped spots that don't deserve them or need them. And then there's none available for those that truly need them. So I hope we can do something about it because there's nothing more frustrating to me. And I'm wondering, did you look into how we can increase the penalty and fines and make it easier to enforce? Like what exactly is the overall goal of this? Private right of action, I didn't get a chance to read the entirety of the bill proposal.
So enforcement general all the way around is a huge problem. And we're excited about the advisory council at DMV because I think they can start to address that. We're visiting the police stations and we're hearing from every department that it is a problem and they acknowledge the problem. Some of the departments are considering like even a one day where they would focus on being out in the community and enforcing. So we were thinking if we could get 300 police departments across Connecticut, that would be every day. But I think the advisory council, when it does meet, this will be a big conversation for them because it is a problem, and everyone has to figure out how to do that enforcement piece.
I will tell you, I've taken video of people that I believe are improperly parked in handicapped spots and sent it to my police for investigation. And unfortunately, I don't.
So there is a multi-tier issue here. And if someone has a legal placard, the police really can't do anything about it. So we're also talking about an education piece with the physicians who are authorized to give a placard. We haven't had the same level of success visiting doctors' offices. We've had some very interesting conversations. Many physicians don't realize there's criteria to give out a placard. But that's a huge endeavor that we do have as our goal. But we, as a nonprofit, we are trying to get into physicians' offices just to enlighten them that there is criteria. And the state of Connecticut has it listed right on the application. Some physicians don't know that there are specific physicians who are supposed to be writing that placard out. It's not your medical assistant and it's not your secretary. So it really, I think it's even a bigger issue that this committee can even tackle. But in just 1 year, we have found so many areas to improve in the placard. One is visiting physicians, one is visiting police departments, then giving them what they need to enforce. You know, better visible expiration dates on a placard. Ours are very tiny, and an officer just can't go placard to placard checking them. So there's a lot of easy ways to improve. It's going to take work. We're taking it on as our nonprofit. So hopefully by talking to the people who can give out the placard, explaining to them that there are specific criteria. I mean, the overlying criteria is a person can't walk 200 feet without stopping to rest or with an assistive device. That is on the top of the application. So there's a lot of work to be done, but I think little by little we can see an improvement. And by seeing, I'm sorry.
No, sorry, go ahead.
No, I think by seeing improvements, you're going to make people within the community that have disabilities that are under the criteria, they're going to feel better. You're going to see them out there. It's just going to make for a better society for everyone. As able-bodied people, we can recognize the need, and we can be more mindful, and we can follow the laws, and it's going to help the disabled community.
And what's the website I can donate on?
Oh, we're not asking for donations, but you can go to the Facebook page. The nonprofit is called Peace, Love, Accessibility, and that's how we want to approach it. We want to work together. We want to see improvements. We want to pass some laws, and we want to make things better.
Thank you very much for your testimony. Thank you, Madam Chair.
Alex said start the conversation.
Right, that's what Alex says, just starting the conversation.
Thank you so very much again, and I don't see any, Representative Reyes.
Thank you, Madam Chair. Majority Leader Candelora, thank you very much for bringing this family here. I've never heard you guys speak before, so thank you very much for enlightening us. I think that the placard, that's issued legally by the state of Connecticut, when you come back to, I think a couple folks already touched on it, the actual education piece. I believe that people think that this is for life, and it's not. It's for the person that it was obtained for, and it has a sunset. But most people believe that and you can see it all the time when you pull up any store, an 18-year-old girl jumps out of the car and runs in with the placard on. So that's grandmas, dads, uncles. So I think the education piece is very important, and I think that it could be a bit of a stretch asking police to get involved with some of this because they're dealing with other quality of life issues that affect us on a day-to-day basis. But I do like what you did mention earlier. I do like the targeted approach, just like we do the seatbelt check and the speeding check and the sobriety checks. We can also do a legal handicap placard check. So thank you for your testimony. Thank you, Madam Chair.
Thank you. We really appreciate everyone's time.
Thank you so much. And again, Alex, Sam, and Mary, I really appreciate you coming up and for all of your hard work and advocacy around this. I will just say once again, oh, thank you, Alex, sorry to interrupt you. Did you want to say? Thank you. Oh, that's nice. I did also just want to say and reiterate one more time that it is, this committee's hope that this council that we passed as a legislative body last session will come to fruition very shortly. So we urge the diligent DMV commissioner who also wants to see this happen. I've spoken with him recently. That we would urge the DMV to get this started as soon as possible. Again, that's outside of this legislation here before us today, but appreciate you being here and testifying for this particular legislation that's in front of the committee today. Thanks so much.